Hey, it's Dr. J, Toronto Spine and Sports Clinic. So, I am doing this video in this format. Why? Because you've heard of it. Telehealth, Telerehab, virtual visits. What does it mean? So, using this Zoom platform, what I'm going to do is I'm actually going to show you how I can help you remotely. But first, let's address the elephant in the room. Chiropractic adjustments, spinal decompression, acupuncture, cupping. Very hard to replace with a virtual visit. I understand that. However, you've worked really hard to get to the point where you are, and you're doing really great. And the worst thing we could possibly do is have you get any worse while you're waiting to get back into the clinic. So, why not try a virtual visit and see what we can do to help you? So, step one on the virtual visit, let's just jump right into it. Step one, let's talk. We're going to sit down 5, 10, 15, 20 minutes. I'll give you as much time as you need to discuss what's bothering you and what you might need for me to help you. The great part about this being a remote or a virtual visit is you could take me with you. If you're having trouble doing something around the house, you could put up your video in front of yourself, do what's bothering you, and I can help you on the spot. Not something we could do inside of a clinic, which is actually quite great. So after we've talked, step two, educate. So again, I already talked about it. If you took me with you and you showed me what you're having trouble doing, I could actually help you and educate you on the spot, and we could find a better way of doing it. However, the other thing we can also use is technology. So we're going to jump into this here. A lot of my patients have seen me use this program. I would say all my patients have seen me use this program. This program is amazing. I can actually go through and show you all the muscles. We could talk about what muscles might be causing you problems. I can get rid of the muscles. We could talk about joints and bones. Finally, I can even add nerves, and we could talk about what nerves are causing problems. So this is a great way to help me educate you when you're having any kind of issues. Back to my face. So, after the education process, number 3, help me coach you to help yourself. Okay? So, what that means is we need to give you the tools to help you help yourself. Okay? Now, number 1, I don't like to have to force patients to purchase things. I'm not a salesman, I'm a doctor. So, what we're going to do is we're going to use everything that you have around the house to help you get better. The other thing I will be doing, again, we're going to pop out here, is we'll be doing some exercises. I could send you a specific to you exercise program, and you can work on this. We can communicate through the program. I can actually see which exercises you're having trouble with, which exercises you're doing. These exercises range from beginner to intermediate to advanced, so we could progress you as we're going through, and we're starting to see some improvement, which is amazing. If you do need products, I have added them. Let me go back to here. If you do need products, I've added them to my website, and you can actually go and take a look. We've made it very cost effective for our patients. Again, number 1, we want to try to use what you have in the house. Okay, if you do need the products, then we'll talk about it at that point. Okay, so that's essentially how we'll go through 1, 2, 3 of a virtual visit. Now I'm going to add a bonus to my virtual visits with my patients. Every patient will get a posture analysis. Okay, so I'm going to show you what this looks like. So if we go here, this is what a posture analysis looks like. Essentially, it's a very simple process. You're going to download an app, which is absolutely free. You're going to take the pictures that it asks you to take, and you're going to hit send. That's it. I will get the pictures that you have. I will do the analysis for you. And the next time we visit together, we'll talk about your posture. The other great thing is, if you see in the bottom there, I can actually give you exercises that are specific to your posture to help improve your posture. So this will be absolutely free for all of my patients that have a paid visit. We're going to throw these in just to add a little more value to your visit and show you that we can really, really help you. Okay? Now, next question is, how do I book an appointment? Well, let's go back to my face first. How do you book an appointment with me? So I'm going to show you our website. This website will be at the bottom of the link. You can see it at the top there, torontospineandsports.square.site. Right off the bat, you see book virtual appointment. Very simple. Click on that. you're going to have a pop-up window. There's your pop-up window. And you can book the appointment. Now, if you see here, there's a free 5-minute checkup. That is absolutely free for everyone. You just want to check up with me. We'll do a 5-minute checkup, see how you're doing. Okay? When we get into the chiropractic consultations, you can see there, book now, imaging consultations, decompression screening, and virtual analysis. Now, the virtual analysis is essentially what we're going to do when we use the posture analysis. Okay? Now, the other neat thing I'm going to show you is if you scroll down, this is where we have our products. So when you do need it, if you do need to get any of these products, okay, you can go into this website and you can find it there. Okay. Now, the one nice thing that let me go back to my face again. There I am. Okay, so another great thing that the insurance companies have done is a lot of insurance companies are jumping on board with these virtual visits. So a lot of your insurance companies will actually cover these visits. So you won't have to pay anything out of your pocket, which is great. Okay. If you have any questions regarding virtual visits, shoot me an email. Call me. I've called a lot of you. I am answering the phone, so go ahead and give me a call, and I can answer those questions as best as possible. So until next time, my name is Dr. Jamal. I'm a chiropractor, and yep, we do that.